Welcome to everyone and our second virtual meetup for Data and the Greater Good. I'm Elaine Gamble. I'm the organizer of Data and the Greater Good, and someone asked me, what does that mean to be the organizer? So what that means to be the organizer is that I have the privilege of organizing these wonderful meetups where we come together as a community that is passionate about data. We hear some of the most renowned organizations in the world. I meet terrific people that attend, and we come and celebrate the beauty of data and what it offers a mission-driven organization, whether it's data, analytics, what they're learning from data, how they're using data. It's an opportunity to show how it helps nonprofit organizations. And we're honored to have back with us tonight, as he spoke last year also, Gary Bagley, Executive Director of New York Cares. And Gary will speak on volunteering during the pandemic, lessons learned, and how New York Cares has helped. And when Gary spoke with us to us a year ago, gosh, that was a very different time. And now we're in a time of quarantine, unprecedented need in our city, and New York Cares has really stepped up for that. So on that note, I'm going to turn it over to Gary now. Thank you and welcome, Gary. Welcome back.
Thank you. Thanks, Elaine, for inviting me to be here tonight. It was just about 1 year ago that I spoke when we could all be in person, but I'm thrilled to be here. And thanks, Bill, for helping get me set up tonight. I'm assuming now that my screen is shared and that everybody can see that. Elaine reached out to me, and I have to say, in many regards, we are in the thick of it, meaning that some of what I say tonight, if we speak a week from tonight, might be a little bit different, right? It's really, times of emergency tend to change by the minute or by, at the very beginning, and then daily for a while. And then at a certain point, we kind of get a grasp of what the overall emergency response is going to look like. We get a sense of how long a recovery might take for the communities that have been most affected. And this pandemic is different in a couple ways. And so I'll point probably during this to some data that we've gathered, some of the needs we're seeing from among our partners, as well as some information on, what we're seeing in the broader, if you will, marketplace, right? What's happening around the city. So tonight, I would like to make sure with you to go over the volunteering climate. What does that look like right now? Some of the info I'll share is first about what New York Cares has navigated. I'll talk a bit about our response. And again, throughout, I'll try to, as appropriate to the topic, filter in information about what our team is seeing, both through our connections with the city, through the frontline nonprofits we're working with. And then for New York Cares, we're part of an international network called Points of Light. And our affiliates are all over the globe, for instance, China, Singapore, Japan, as well as San Francisco, Seattle, Atlanta, Chicago, some of the areas on the globe that have been incredibly affected through the pandemic and have helped pave the way for some of what New York Cares is thinking about right now. So in terms of what we see, one bit of framing I would give you, and we'll talk about this more in a little bit, but to offer up some context on our particular perspective, New York Cares has a memorandum of understanding with New York City Emergency Management. And in that understanding, New York Cares is designated as being the group that will mobilize spontaneous volunteers post-emergency. Spontaneous volunteer is a person who shows up to help right after a disaster. Often those folks are showing up before it's clear where you even need help, right? But part of New York Care's job is to both work with those volunteers, train those volunteers, and then work with the nonprofit sector and our city agency partners to figure out how to best deploy them. So some of the numbers I'm about to give are coming from the perspective of our playing that role. So this is actually, I pulled this off of our Salesforce database. And this is a visual of how we've been tracking volunteer interest since March 16th, okay? The week before, New York City Emergency Management officially activated, which means they've officially stated we are in emergency response mode. Everyone take on whatever role that is. For New York Cares, that meant enabling our website to gather interest, a campaign where we got the interest of individuals who expressed an interest in helping somehow in the disaster. Now, we don't know exactly what they were envisioning. This was the place where we collect basic info so that as the situation became clearer and where help was needed, this would be the pool of people who would be our first outreach. You'll notice also, and actually if anybody happened to be on my presentation last year, we have a pipeline, a volunteer pipeline that's very clear for us internally about creating an account. A VIF that you see there is a volunteer info form. The next step in our process is that you register for an orientation. Orientation is now self-guided, done from home, right? But we look at each of those steps, and then as folks were expressing interest, we were on a daily basis following where they were in our pipeline so that we could assess a couple things. First was volunteer interest and how it was evolving. We were expected in our role to report back to the city on what we were seeing, and we were starting to navigate two things at the same time. One was a flood of requests for certain kinds of help, and another was need from some partners who were no longer able to support volunteers. So to follow that particular a bit of activity, the team put together this dashboard that was looking at the total number of projects that were being proposed to happen at this particular time, right? So through groups like New York City Emergency Management, NYC Service, various networks, organizations are also told to come to us if they need volunteers. So in this moment in time, we're managing, if you will, both the supply and the demand. So here, just so our team could track and report back well on what was happening, we were able to look at projects that have been submitted that were in some part of the launch process that were being reviewed. Of course, there were some that might be denied or deferred. I can give more detail on that if you like, but not every project that somebody needs necessarily is appropriate for spontaneous and untrained volunteers. But we often will direct those groups to where they could get, whether it's a skills-based volunteer, one-on-one help, or something that might not fit in our model. The next thing that we were doing for our team, and we'll talk a bit about New York Care's ongoing strategy, but as we started really getting all of these requests in, it was important for us to look and go, where would they be in terms of physical location, right? Where would the organization's presence be across the 5 boroughs? Our mission is to meet pressing community needs by mobilizing caring volunteers in service. That is a New York City mission, but we are committed to distributing our services to where they are most needed. Now, New York City is a very high need city. There are very few neighborhoods in our city that don't have some concentration of high need individuals. But as I'm sure you're seeing as this particular pandemic evolves, certain neighborhoods are being far more affected than others. Right? And as New York Cares constantly grapples with that question of what does it mean when we say most pressing needs? We're here to meet pressing community needs. Well, in every moment in time, we have a mission obligation to say what is most pressing as we determine what, with limited resources, we're able to do next. So, those are a couple items we've used, and I'd like to talk you through what that's meant in terms of our actual response. During that, I'll share a little bit about some of what we're seeing, both in terms of volunteer interest, what we're hearing from some of our partners that aren't related to us specifically, and what I'm seeing, in some cases across the country. So, our response, I wanted to, again, just set some context first. I mentioned before our memorandum of understanding with New York City Emergency Management up there at 10 o'clock, right? What this particular mobilization does for us, when there is a disaster that occurs where we are not necessarily physically limited like we are now, New York City Emergency Management actually has an emergency operations center, a big room where a lot of different groups have desks. New York Cares is one of those groups, along with some of the city agencies you see here, the fire department, the police department, Con Ed, all the different major institutions that may be affected or need to be mobilized at this particular time. Of course, that is now a virtual convening, and we are most in contact with the groups that are listed here, including the thousands of nonprofits that we work with ourselves. One group that you'll see there at about 8 o'clock is the Food Access Lead Team. Post any disaster, almost always one of the very first needs that comes up are, as I always say, the bottom of Maslow's hierarchy, right? Food, shelter, clothing. In this particular disaster, food was going to be unquestionably a major issue. And we'll talk in a minute about how the entire system was affected. So the Food Access Lead Team is a subgroup that's convened by New York City Emergency Management to specifically make sure that the distribution, the access and distribution of food is done in as coordinated a way as possible, right? A lot of what you'll hear now, and one place where volunteers with a good network can be a really good solution, is one of the biggest problems is a rush of resource that comes in this case to New York City, and then trying to manage the distribution of it so that it all ends up in a good place, right? In a physical disaster, you'll sometimes see, those horrible pictures of, pallets and pallets of food in one place and no food physically in another place, right? That's what we're trying to avoid. So, in terms of our own ramp up, we were doing needs assessments with all of those groups. Our team actively reached out to 500 agencies and schools to find out what they needed, how New York Cares could be helpful. Those include all those city agencies that I listed there. And then in terms of ramping up, what this meant for us was really a complete change to our delivery model, right? The volunteer that goes to the soup kitchen and hands out a meal, that's no longer an appropriate setting, right? The pandemic has changed our model and what is considered safe in terms of both in person and what it means to be a client. We also needed to do website upgrades and take our entire orientation process and make it virtual, so it's self-guided, since in-person orientations would no longer be advisable. Because our systems have changed, we've looked at new privacy and background check policies. We had to adopt a phone banking system, and I'll talk more about that a bit later. We also just had to formalize our agreements with the New York City Housing Authority, the Department of Ed, the Salvation Army. And as I always say, I'm obligated to make sure folks know, as the executive director of a nonprofit, I mean, one of the reasons these moments are particularly ambiguous and challenging is what we see as huge need that is going to require huge resource to meet, and yet we're in a very uncertain financial time. So very early on, we said, listen, we need relief funds. The least we imagine needing is $3 million. That number actually was a pretty darned good guess, I will say, in the early part when it felt more like a guess than an educated budget. But when we looked at, how much we would do, how much staff that would take, we looked at that. So here's what we're seeing. The need in hunger is enormous, right? Here, nearly a third of the food banks have closed. The ones that are still open, many are reporting, 4 times the visitors as the system, the folks who use the system are shifting where they go. We have one partner that used to deliver about 200 meals a day. They're now delivering 2,000 meals a day. Now, this was also at a time when they had to totally re-envision the entire way they worked, right? Many of the food banks were figuring out how to move out and serve on the street so they could observe social distancing. Those were still in person, where you'll see, I think sometimes in the newspapers now, have lines that where the individuals are 6 feet apart waiting for food. Very little hot food delivery. Most of it is now grab and go. Again, just because the system maintaining some sort of safety is difficult. Our own part of this response has been over 330,000 meals served. And we are tripled our emergency food service just since March 16th. I was talking to our team today, just to give you a sense. Our work in the month of May is nearly double what it was last May. Now, one other perspective I'd give you, just to see where this kind of issue can end up, is that last year, or when this started, about a third of our partners also had to stop service for whether they couldn't maintain the amount of service or the safety needs. So we're imagining everything we're doing now, plus our other partners coming back. So we're imagining triple to quadruple the need in hunger just through our organization. And that comports with what we're seeing citywide. Phone banking. I mentioned before, tens of thousands of public school students are still unable to access online learning. And this is a place where volunteers have been a huge help. We have developed our phone banking system. You can see we put up a little bit of the beginning of the sample script on our PowerPoint, but we're in the midst of now reaching out to 25,000 families. We hit our 10,000th family over the weekend. And here it's everything from making sure that they actually have an iPad, right, up to, if you do, can you get into Google Classroom? Are you able to access your Wi-Fi? And I would say it's sobering to see what a small percentage actually have gotten their actual iPad and are able to access the online learning. And a sad stat is that only about 40% of New York City students are now having daily contact with their teacher. And so as we look at what the need is going to be even further along, there's going to be a huge need for volunteers to step in virtually. Groups of students who were behind at the beginning of the emergency are falling even further behind, meaning the catch-up is going to be even harder. Want to let you know that we are relaunching adult and children and teen education. We have 120 projects happening this month alone. That is only about a fifth of what we would normally have in terms of education programming. So we're thrilled to get everything up and running, but again, need a lot of support there. One thing I wanted you to know, just because it's part of thinking about how we distribute our programming, and what we distribute is that we're actually in the middle of this year of piloting a couple interventions. One was to get English language learners on grade level by third grade. And the other was to get more parent and caregiver engagement, especially in harder to reach neighborhoods or higher need neighborhoods. And we got some very good immediate response from our first year pilot, seeing 30% of our students growing at 3 or more reading levels and 80% growing by 1. So as we're thinking about this particular recovery, one thing I would want everybody to know as we think about data is there's immediate needs, right? Getting somebody a meal, and their impact is pretty clear, right? It's, I served X number of meals. It's an output that has a pretty strong indicator of an outcome, right? Meaning that somebody is fed. You can go further down, make sure they're fed regularly, etc. On education, right, this is what long-term recovery is going to be about, right? Which interventions catch students up, keep them on grade level if they're behind grade level, engage parents as part of the solutions, and those both building of education and building of community are going to be part of the longer-term recovery, which is one of the things we're really looking at. You may have seen this next need is particularly acute, which is there are many populations that were isolated before social isolation, right? Many vulnerable populations, whether it's seniors, people with special needs, a variety, and people with a variety of health conditions, right? And the one, I guess, priority that I've seen from the city that is that I'm grateful for was the recognition that there's physical hunger coming out of this disaster, and in numbers that are just very sad, but a reminder that folks who might have faced mental health challenges or isolation going in to this pandemic, that need is now exacerbated or exponentially higher. And there are many people who may not have experienced severe issues before, but in crisis situations are. So right now, we are, and I'm excited to say, starting to launch next week with the New York City Housing Authority, as well as Department for the Aging and a couple senior centers, phone bank outreach wellness checks. Some of those will turn into ongoing socialization, regular socialization calls based on the needs that we identify. Our estimate now is that we'll be making anywhere from 30 to 60,000 calls over the next 3 to 6 months. And then, of course, we'll have ongoing calls after that to support individuals who are isolated. One thing I would say I've also observed, and I've mentioned this, on a few different calls as something we're watching, is the most vulnerable populations were the ones in late February and early March, where folks were recommended to isolate or quarantine, stay home, right, because of known vulnerabilities. As we think about reopening New York, that first group out, if you will probably be the last group back in, right? So they will be the group that sees the longest period of isolation, groups that have already been experiencing that. And so thinking about the longer term needs there is going to be immense for our city. By the way, this is also a place where I would say, your nonprofit partners, your nonprofit infrastructure, your healthcare infrastructure, these infrastructures are already stretched to the limits. And one thing that we're seeing is, many staff members that were working with vulnerable populations may have contracted COVID, right? So the front lines in terms of social services are weakened. Clients are higher need, and we're trying to figure out always every day where volunteers can be the best solution in the midst of that. So where will we go moving forward? This is probably a heck of a lot more information than you want, but I'd love to share. I love to share what we're thinking. What we're looking at is to say, where can New York Cares, as one part of the ecosystem of helping New York City get started again, and help us through the long-term recovery, is we started to look and say, in what neighborhoods should we most focus our efforts? Now, you've probably read in the press that some areas of central Brooklyn, eastern Queens, the South Bronx are seeing much higher concentration of cases. And some of what you'll see here is our team developed this rubric for identifying what neighborhoods we should prioritize serving first because they are of the highest need. This was done on a weighted basis that, if anybody's really, as I always say, really geeking out, I can make sure to share back later what the different weighting was. But we were looking at the number of cases, the food insecurity in the area, housing insecurity, real prominence of communities, many of which were underserved or in need before the pandemic. And from that, mapped out a couple possible areas. These are the same maps. The one on the left is without gradient neighborhood by neighborhood, where in blue you'll see slightly different concentration depending on the specific neighborhood. On the left, the darker red is because at this point we are already in discussion about zeroing in on Eastern Queens as one of the focus areas. We're in discussions with local elected officials, trying to understand the neighborhood and how New York Cares can serve it better. These are things you may have gleaned from reading in the papers, but I really feel, compelled every time I speak on this topic to bring this up because it's really important. Central Southeast Queens, East South Brooklyn, Northeast Staten Island, and the Bronx are facing significant challenges. They were before the pandemic, and they will, and therefore they've been more affected by the pandemic, and therefore the recovery will be longer coming from the pandemic. That includes, people of color, new Americans, individuals living in low-income areas are facing greater challenges. It's very much about the way the city's population is distributed. It is about the ways poverty is distributed in the city. And therefore, one of the messages I like to sort of make sure to share, but to end with, I guess, because I'm about to go into our question section. But one thing that can happen after a disaster, and it's something I'm asking all of you to join me in communicating in a different way. A lot of individuals will start to talk about some of the most affected neighborhoods, and we'll say, let's help them get back on their feet, right? Let's get them back to where they were. And the message I really want everybody to hear loud and clear is they weren't where they needed to be, right, before. So getting them back where they were is the first step in what was a lot of work to try to help communities improve by supporting them in the efforts that they're engaged in to make the communities they live in better, right? Everybody wants to live in a good, safe neighborhood, and the work we do as volunteers, the work of the social services sector, and the work of the city should be to uplift that work. And so if you're able, I always ask folks that to join us, if you will, in that work. I wanted you to know, in case you'd like to get started with us, you can just visit newyorkcares.org. From there, you can do a self-guided orientation, and There's a place where you can express interest. For some reason on this particular call, I thought we might have some folks interested in helping with the Department of Education tech support calls. But we do have wellness checks coming, and a lot of other programming that'll be starting up over the summer. I always say in my job, I'm obligated to let people know how they can also donate financially if you're so moved. And you can do that right from our website, or you can text NYC Relief to 474747. It does take a fair amount of resource to make sure that we can be there for the city we love. I would say, in closing, New York Cares at this time, our board of directors, our staff, everyone is committed to stepping up, not stepping back. And in the face of what can be great financial uncertainty, understandably, many groups are, hunkering down. And New York Cares is figuring out how we can be fully present at this time. So I thank you all for that. And I want you to know, Elaine promised before, my contact info in case we have questions that we don't get to today. You can catch me on all that different social media. And now I'll turn it over. I believe, Elaine, you're going to moderate the chat for me and the questions. Is that correct?
Yes, Gary. Well, Gary, thank you so much for that informative talk and inspiring talk. And some things we may have known, but we got a different perspective on it. And some things, we just may not have understood. So greatly appreciate your bringing that wealth of insight. So at this time, we're going to have a Q&A. And we do have a few questions. If you have your questions, you can type them in. We have some that we received in advance for you, Gary, in advance of the talk. So I will share those. The first, is it hard to recruit volunteers in the areas of greatest need when the areas of greatest need have the higher rate of COVID cases, and some could perceive it as higher risk to volunteer there? And often that is linked to poverty and areas related to that. What are your thoughts, Gary? How do you serve the areas of greatest need when some could perceive it as the area of greatest risk?
One of the greatest challenges of this experience for the team and and some of the really hard decisions I had to make were in the early part of this of the pandemic, when it was still not 100% clear. I often say to folks, remember those many moons ago when we were being told to wash our hands and that was it? In the middle of that, we were hearing senior citizens at our risk, and you're bringing volunteers, and some volunteers are over 60, right? And there were all sorts of questions about, I don't have a right to ask somebody how old they are or if they're in good health, right? Like, we have to permit a certain amount of self-monitoring. So the decision we made from a health perspective was to align with the city's guidelines. So at this point, city and state are saying nobody volunteer over the age of 50, which was a really hard decision. So when you get to this volunteer concern, I think, I often say disaster response teaches us that most people run away from an emergency, and then there's a very special group of people who run toward it. That was true of Hurricane Sandy, and it was true of this. Within 2 weeks, I think, we had 12,000 people express interest in going out to help in the face of the pandemic. So I often say our wasted energy at New York Cares is worrying about recruitment, because that always seems to take care of itself. We get the word out and people come forward. What we really did have to do, though, was manage carefully that people understood whatever risks there were for themselves. So on a New York Cares project, a volunteer team leader has a script, reminds people, if you're over 50. Back in early April, it was if you've been traveling, from Europe or Asia, et cetera, that, they're instructed to advise you to go home. If you're displaying any symptoms, whether you say they're COVID-19 or not, it's okay to send that person home. And then we make sure we're adhering with the city's guidelines. We have, it is amazing to me, early in the process, we would put up a project and it would fill so quickly that our website looked like we didn't have anything to offer, because our website is set when something's full to take it down, because volunteers get frustrated looking at a lot of opportunities they can't fill. And so all of a sudden it looked like New York Cares wasn't doing anything. And the truth was, we were running as fast as we could. And people had just stepped up. So I do think, if anything, we have to keep reaching out to volunteers to remind them of safety protocols, to remind them that it's okay if they don't feel safe to step back now and let someone else serve.
Okay, thank you, Gary.
Sure.
Next question. Will New York Cares post virtual opportunities to volunteer for an emergency food bank services organization? I would think yes.
Well, right now, our food opportunities and the real need is for the in-person service delivery, the actual packing of meals, delivering. And by the way, a lot of delivery has turned into, door-to-door drop-offs, right? So the idea of 20 people standing at the kitchen preparing the meal and handing it out is turning into people meeting at the truck and going off and delivering at addresses. So some of our partners are trying now more to track incoming requests, because they're all seeing just tenfold increases in the number of clients. So there's a possibility that there will be some remote program projects there. But I would say the best, and sadly, hunger is a topic that's going to come up on those wellness checks that we talk about, because part of what we're reaching out is make sure people are getting food. Are you getting 1 meal a day? Are you getting 3 meals a day, right? Do your neighbors check in on you, right? Some of the things we might take for granted in our apartment building or our neighborhood, the folks who struggle the most are the ones who don't have that social network. So I'd say you might think immediately of helping a food group with hunger, but I'd say those wellness checks are going to surface many issues, and that might also direct you to more ways to help.
Okay, thank you.
Sure.
Were there moments where you had to act without data during this pandemic? So you in a situation where you didn't quite have the rationale of the case, but just got to make it happen, or just got to make a decision?
Yeah, a bunch. And one of the big ones was the closing down of our programming, right? There was this weird moment where, I don't know if you all remember it, people were saying, stay home if you can, but after school programs were still running and the subways were still running. And so there wasn't enough information to decide what the right thing to do was. And I'll tell you, we discussed everything from keep everything running to stop everything, right? And that depends for us on which stakeholder you look at, right? For the volunteer, you say, all of you stay home. But then you go, okay, there are these kids who aren't going to get the reading program. There are the people who aren't going to get a meal, etc. Like, we would knowingly be shutting a system down. So I would say that was one of the times of greatest uncertainty in this. And then I feel like if I think a little bit more about it, I've probably made a daily decision without data. And I think one of the challenges at this time, and this is more of a if you will, a leadership reflection, and I think my entire team is feeling this. What used to be calling a school and working with them to have a reading program, those we're calling out to folks now, and all of our stakeholders are living through a crisis in addition to trying to help others through that crisis. So our front lines are hearing stories that would break your heart. Kids who are basically stepping up to take care of the family, and aren't getting their education because they're fifth graders who are also cooking for their parents, right? So there's no data in that call, but you have to do something, and figuring out what you do. And then as you deal with each of those, figuring out like, when does this generalize to something that the organization needs a broader intervention for, is seems to be a daily question.
Mm-hmm. Okay. I'm going to speed up here a bit.
Yeah, I see the
so
time.
we get all of these in. How do you operationally handle doing a needs assessment for the hundreds of organizations that you serve?
Great question. When we activate in an emergency, one of the fun messages I first get to deliver to staff is that your job descriptions mean nothing anymore, right? That what our job is in this moment in time is to all step up and adapt our roles to whatever our city needs. So proud of the way our team, just one day I heard they're making 300 calls this week to all of our partners, to ask them what they need, and to not just ask them what New York Cares can do for you, to ask them what they could experience, because what we're experiencing, because we could also then report that info back to the city in a way they may not be getting the info. So I will say, as much as I'd like to say we sent out a careful survey, the truth is we knew our partners didn't have time to sit and fill out a survey. And our partners who are serving some of these really traumatized neighborhoods were traumatized themselves. And we wanted them to, in that moment, hear the voice of New York Cares on the other end of the phone. So it was, as I keep saying, smile and dial. That's what we did.
Mm-hmm.
And by the way, we had ways to then collect the data that people were hearing, in our system. But, the initial outreach was break up the list and everybody start calling.
Next question. Any safe opportunities to help for families with older children? A single mom with kids aged 12 and 14 looking to help somehow.
I would say engaging under the age of 18 is very difficult right now. It is hard at any period of time, to provide a good experience for someone who's under 18 takes extra management for the organization that's making use of that volunteer. And so most have shut down any kind of teen volunteering for the present time. I would say, for mom, in this case, just going to New York Cares and signing up is something you can do. When the environment loosens up, and who knows when that will be, we do offer a number of family-friendly opportunities, like visiting senior centers, some of our parks projects. We'll take a parent or a caregiver or a guardian with a couple teenage kids, like 12 and 14 are very reasonable ages. In this particular time, it's going to be challenging.
Okay, I think that is we have time for one more question.
Great.
Which technology solutions or platforms, other than Zoom, have you found to be most useful for organizing volunteers and keeping programs running remotely during this time?
Really great question. Interestingly, New York Cares had switched over to go Microsoft platform across the organization about 6 months ago. And I'm really glad it was 6 months ago, because we went through our bumps then. And part of our test the week before we went fully remote, each department was remote for one day. And the instructions were test out Teams, have your team meetings. So in-house, we're using Microsoft Teams. The DOE is using Google Classroom. Our team has switched between everything from Google Hangout
to Microsoft Teams. There was Zoom was in the mix at the very beginning. I will say the Department of Ed, as of last Friday, I think, announced that it was going back to Zoom. But right now, we've been leaning most heavily on Microsoft Teams. We know the platform, and it's working well. In terms of managing volunteers, we use Salesforce, and because we're invested in volunteer management for a long time, we have a custom-built database where we're able to track volunteer info as well and activity, as well as our project activity, which then shows up on the front end of our website, which we use Drupal there. And so all of that has been customized, but there are some off-the-shelf data and volunteer management systems that, if you're especially starting up, would probably suffice. And if you email me after, I'm happy to get you a list of those platforms.
I do have one last point, just absolutely last question.
Okay.
Can we get a list of the 100 plus nonprofits New York Cares partners with? I would imagine that would be on your website.
It is. And now, one of the best places you can see that is in our annual report. You can get a list of the nonprofits and public schools that we work with. And then if you don't readily find it on the website, feel free to shoot me an email. It's something I can send right back to you.
Excellent. Well, Gary, thank you so much for inspiring us this evening. And again, we thank you and your organization for the wonderful work that you do through this difficult time. And again, greatly appreciate your coming back to talk to us and inspire us again. And thank you all. And again, we look forward to seeing you again soon. Bye.
Thank you, everybody.
Good evening.
Bye-bye.
Thank you.